Now, the last few days, everyone's talking about 100 men versus a gorilla. Now, it's been a crazy conversation, but I saw a post that said 100 men saw a therapist. And I guess it's a shot at men and masculinity and being in touch with your feelings, emotion, whatever. But it made me think about this. Why is therapy seen as an end-all, be-all to every solution when it comes to mental health, mental performance? I'm gonna tell you, as someone who comes from that field and left the clinical side for this very reason, it ain't. Because just like in any industry, there's bad lawyers, there's bad doctors, there's bad mechanics, there's bad pilots. There's a lot of bad professionals that don't always do a good job in their chosen field. And there's no difference in therapy. But for some reason, therapists get this magic wand that they all can help you. There's a lot of people who are just as messed up as the people they're seeing. Matter of fact, there's some that are worse. Now, it's not to say that therapy can't help, especially when it's done by a proper professional, but imagine having a lawyer who has a super big caseload, say a public defender, and they don't really care as much. They're not that good. They didn't go to the best college and they're about to defend you for a trial. Let's say it's 10, 20 years in prison on the line. And say they're not that good. Guess what's gonna probably happen? You're not gonna get the best case scenario in that case. So same thing with therapy. You have to have someone who's practical, understands application, who can deviate from what they need to do in your situation versus a cookie cutter approach. Because in this industry, there's a lot of that. Embrace your feelings, do what's right, do what makes you feel happy. And I'm gonna tell you that's a bunch of BS. And I'm not trying to get like over the top with this, but it's not that simple. So when we write off therapy as just this magic pill, like any other thing we do, we always gotta go to the extremes. It's not. The person needs to be good at what they do. They need to have the insight and the ability to read the situation, not just validate what you're feeling, but also give you the hard truths that can make you actually better. That's why I like the mental performance side, because that way you can teach them the skill sets to be the best they can be in a practical manner. Now, it doesn't mean clinical doesn't have its place, because if it is, you need that help, go get it. But make sure, just like any profession, you do your research, get the proper help you need to get your mind right.